Hello, everyone. Thank you for joining us. Welcome to the Avexia webinar series. Our topic for today is full spectrum heart, liver, and metabolic assessment with Cardiometabolic. My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your host for this webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Dr. Stephen Bennett, who will be our presenter for this webinar. Stephen Bennett, CEO and founder of Cardiometabolic Labs, has practiced functional medicine in California since 2007. As the impact of fatty liver on cardiovascular and metabolic health has become the focus of increasing research, Dr. Bennett has observed and incorporated its key connections into cardiometabolic physiological testing. Without further delay, I will now turn the webinar over to Dr. Bennett.
Well, thank you, Chris, for the introduction. My name is Dr. Steve Bennett. I am the founder and president of Cardiometabolic. Today we're going to talk about a really innovative and useful tool for your functional medicine practice. That is the Cardiometabolic test and report. So just to get started, setting the stage as functional medicine practitioners, as you all know, our main focus is trying to inspire our patients towards better health. We use different tools to do this. Some of the main tools we use are clear, compelling, cost-effective lab diagnostics. And if we use these correctly, they can improve our efficacy, enhance our efficiency, and really encourage our patients to engage in this powerful form of health and wellness care. CMIQ, which is the parent company, brings innovative research-backed analysis for you and your patients. Our custom physiological blood panels and detailed reports are the tools you need to deliver high value to your patients and help them achieve healthier outcomes. Our tagline is Smart Functional Health, and that's what we aim to deliver. Our flagship test is the test we're talking about today. It's called the Cardiometabolic Test and Health Report. It's a dried blood spot test that retails below $150, and it does a really nice job at testing cardiovascular, metabolic, and liver health. Just quickly, the family of CMIQ tests is growing rapidly. Today we're talking about the top one here, Cardiometabolic, which is heart, liver, and metabolism. Soon we will introduce Thyrometabolic, which will stack a full thyroid panel on top of the Cardiometabolic test. And subsequent to that, we will have two endometabolic tests, one for male, one for female, which will take the Cardiometabolic and stack female and male hormones on top. The reason for that, as you all can guess, is that our cardiometabolic physiology is impacted significantly by thyroid function and endocrine function. So we'll be bringing those to market soon. Stay tuned. So in the big picture, functional medicine, I've been practicing since 2008, and I think many of us feel that it's really never been better. The awareness for functional medicine is really at an all-time high. When I started, nobody knew the term functional medicine, and now it's much more widely appreciated. And frankly, one of the reasons is there's a growing dissatisfaction with traditional healthcare paradigms. We see it every day in practice. Technology is definitely enhancing our ability to reach out and help more people. AI is playing a role in terms of allowing us to do a better job and help more people as well. I think most of you probably have seen TrueMed. This is a company that helps to allow people to use their HSA, FSA funds to spend those funds on functional medicine services. That's a big plus. And honestly, people are looking for what we have, which is awesome. As always, in any business, growth is always top of mind. And in this case, patient acquisition and conversion are critical steps. And this test is designed with that in mind. It's supposed to be a tool that makes it easy for you to grow your practice. There's a term out there called healing at scale. That simply means being able to help more people by making use of efficiencies associated with technology and AI. And in this kind of context, the right lab can make all the difference. And so what makes a great practice building lab test? So cost is obviously important. We want it to be manageable for our prospective patients and our existing patients. We want to be addressing highly prevalent conditions. Cardiometabolic affects 93% of the adult U.S. population, so I'd say that's pretty highly prevalent. It's important that we deliver actionable, evidence-based results, insights, and guidance. Data is wonderful, but data to our patients is not as useful as converting that data into useful steps to improve their health. We want the report to be patient-friendly. That's something that we really focused on with Cardiometabolic. And we want to, if your practice uses nutritional supplements, we want to help you drive that piece of your practice, as well as additional lab tests that may be necessary based on the findings of the cardiometabolic test. And as with some tests, not all, repeat testing is significant with cardiometabolic. Checking in on how we're doing with our lipids, with our insulin resistance, with all the markers that we're going to be talking about is something to be done annually, sometimes more frequently depending on the patient. So Cardiometabolic, fortunately, by design, checks every box. Cost effective, it's below $150, practitioner price. It affects cardiometabolic physiology is important in that 93% of the adult population in the US has shown to be suboptimal in terms of their cardiometabolic physiology. The test is evidence-based. I am a fiend for research, and that will show true throughout this test. We do give nutritional supplementation generic. We don't specifically touch on brands because that's up to the individual practitioner. We have the Cardiometabolic 10, which is a set of clear, cost-free action steps that everybody can take advantage of. And we really tried hard to make a test that had a report that you could hand to a patient and they would be able to absorb a useful amount of information even without your guidance. And then when you step in and you go through the report with them, you can really tease out a bunch of interesting detail that will add additional value. So it's a neat format. I urge you all to take a look at it on the Avexia website. Once again, we do fit into the annual and semi-annual retesting, so that's good from a practice standpoint too. As I mentioned earlier, this test that's referenced at the bottom of the page by Dr. O'Hearn back in 2018, I think a lot of you have probably already seen it, but 93.2 or 3% of the population at that time was in suboptimal cardiometabolic health, and I would venture to say it's probably gotten worse since 2018. Here's where the strength of the test is. It clearly and completely assesses vascular, hepatic, and metabolic systems, and it does so in an interconnected format. So, as we all know in traditional medicine, there is a siloing effect where cardiology handles the heart and vascular. We go to a liver specialist for the liver, and endocrinologists and primary care are managing metabolic function. Looking at it as an interconnected system is much more effective in terms of explaining it to your patients and motivating them as to how to best approach improvement. We go to great lengths to explain the why. Why do these things matter? How do they interact with each other? Not just numbers and large words. The test report is a hybrid format that we feel is specifically designed for healing at scale. It is really well suited to doing group screening. And this is designed to be cost effective for a large portion of your practice. I've used a number of tests throughout my practice, and there's some great GI panels, but they run the patient $500-600. When they're appropriate, they're necessary. But it sure is nice to have something that we can do for less that delivers a large amount of useful information. We also have a feature on the website that the patients can access. These are biocalculators. So if they are the kind of patient that likes to get involved in their health, they can look at the markers that we go through on this test, and they can play around with the numbers and find out, hey, if I drop 10 pounds or I take an inch off my waistline, what is that going to do for my fatty liver index, or what is that going to do for my triglyceride-glucose index? how can I reduce my relative risk of various diseases by making small changes in my numbers. Why did we make this test? Well, it started off actually with fatty liver. I looked around a couple years ago. I was looking for a test, a home blood spot test that would do fatty liver index. That was the one test that I had found to be most appropriate and the most accurate non-invasive test for fatty liver, and nobody was testing it. So I set out to create a fatty liver blood test for home use. And the more I dug into fatty liver and cardiometabolic health, I realized that just doing the liver was a tremendous disservice, and we had to look at metabolic health and cardiovascular health together as one interconnected system if we were going to do the right thing. So there aren't any other tests out there that do accurately assess fatty liver index along with cardiovascular markers and metabolic physiology markers. I have found, and I'm sure some of you have found, that there are some amazing cardiovascular tests, but they have sometimes more markers than is appropriate or necessary, and each of those markers comes with a cost. So with the intention of having a cost-effective test, we tried to be efficient with our markers and use smart markers that had a lot of research backing, and not use redundant markers or markers that are out of date. The fatty liver index, I mentioned, it is the gold standard for non-alcoholic fatty liver disease. We also took a deep dive into insulin resistance, and I found in my research that the Triglyceride-Glucose Index, when used in conjunction with a waist to height ratio, really gives you the most accurate assessment of relative risk for cardiovascular and metabolic disease and many others. And many tests, because they don't test fatty liver, they ignore the significant impact that NAFLD has on kidney disease, cancer, cardiovascular disease, diabetes, Alzheimer's, a whole bunch of other things. So if you're not looking at the liver and looking accurately at the liver, you're going to miss a lot of the risk profile. One thing that I don't know that many people know is that ALT and AST, the standard liver enzymes on a comprehensive metabolic panel, can miss up to 80% of fatty liver because they're really just not suited towards teasing out NAFLD. The fatty liver index is much better at that. It uses GGT, BMI, triglycerides, and it's been around since 2006, and it's very well validated. So the FLI is a big plus for this test. One of the things that we did was we created an overall marker for the patients. Now, this is strictly informational. This is not something that they can take to their MD and ask what their relative risk for heart attack is. But it ties in all 10 of the critical markers, and it gives them an idea of where they are overall. We are constantly reviewing relative risk and weighting, and we've taken great pains to try and weight this thing accurately based on a tremendous amount of research. So this person's 6 out of 10 really gives them an idea of where they are in general, and they can look at the individual markers and find out where they're going to get the most bang for their buck in terms of improvement. The action steps I referred to earlier, these are on page 2, I believe, or 3 of the report, and these are 10 of the best things that I have found. They're free, and these are action steps that anybody can do, and they don't cost anything, and they are proven to be effective in terms of improving cardiometabolic physiology. So what was missing in the other tests out there when I designed this test? In general, it had to do with connecting the dots. Some tests are really great at laying out a bunch of markers for cardiovascular risk. Other tests do the same with metabolic, but it really falls short if you're not looking at the big picture and you're connecting the dots. Insulin resistance, fatty liver, and residual cardiovascular risk were 3 of the things that we really focused on, and you need to be looking at those together if you're going to give the patient a good overview and a solid relative risk profile. Some statistics, I hate to bore you, but 70% of the 40 million type 2 diabetics and 35% of all US adults have fatty liver. That's a big number. That's a big group. and we need to use an accurate marker, fatty liver index, to tease out who is having fatty liver. Many of you probably know, but fatty liver worsens insulin resistance, cardiovascular disease, kidney disease, diabetes, breast cancer, and more. So it's like hypertension. People don't usually feel fatty liver, but behind the scenes, it is contributing greatly to pathophysiology. Another stat that's kind of mind-boggling is 75% of type 2 diabetics die of cardiovascular disease, and 70% of them have fatty liver, and their cardiovascular disease is greatly worsened by fatty liver. So if we don't tell our diabetics how to manage fatty liver, we're doing them a disservice. The LDL statin paradigm, as you all probably know, has been debunked in large measure. The residual cardiovascular risk from things like remnant cholesterol, inflammation, insulin resistance, and oxidative stress, that's really where we need to focus if we're going to give people a solid idea about their cardiovascular risk. As I mentioned earlier, insulin resistance is kind of the keystone of this whole thing. And of all the markers out there for insulin resistance, my research has led me to conclude that Triglyceride-Glucose Index is probably the most accurate and highly researched marker for insulin resistance. And one of the great things about Triglyceride-Glucose Index is triglycerides and fasting glucose have been recorded for decades in the national registries, both here and in the UK. So we have a tremendous mine full of data that allows us to look at TYG and various disease states and correlate the two in terms of relative risk. Also, we all probably know now that BMI is falling out of favor. It's not a very accurate way to look at visceral adiposity or body composition. The waist-height ratio is a pretty solid one for body composition. We use that, and we also correlate it or tie it together with TYG for a modified insulin resistance that has even greater accuracy and context. How the test works, it's a very straightforward dried blood spot test. It's processed through clinical reference labs, one of the biggest reference labs in the nation. We use the ADX 100 blood spot card. There's a finger stick video and instructions on our website and in the kit. We ask the patient to enter a few simple biometrics. The waist height and weight are entered when they register the test. Got about a 6 to 7 day turnaround time. And the final product is a 12-page personalized PDF report that is delivered to the practitioner. And once again, just to highlight, that report is valuable not just with the practitioner's guidance. If a patient receives that report and you can't see them for a few weeks, they're still going to be able to go through and get a lot of value. And then you'll be able to take that value to a whole nother level when you sit with them and go through the report. Biocalculators, I mentioned those. We'll touch on that a little bit further, but it just allows the percentage of your patients that want to dig into the details and really project where they are and where they want to be. They have access to these for free, and they can do so between labs. In terms of which markers and indexes we chose, the thing that really dawned on me early on is that more markers is not necessarily better. As I mentioned earlier, the NHANES database has a massive amount of information that we can use, and as long as we're using markers that they were testing, and triglycerides and glucose and LDL and HDL, those sorts of things have been recorded to the tune of, I think, about 150,000 person years of data. So we've got a tremendous amount if we're using it. Now, contrast that with other important markers like ApoB or Lp(a), things like that. Very important markers, but the retrospective data just isn't there to really flesh out the relative risk. So if we're using great deal of data from NHANES and UK Biobank, we can do a lot better work. Instead of just a dot on a red, green, yellow scale, we try and use that dot to convey relative risk. Not just, hey, you're in the normal range, you're fine, have a nice day, but here's where you are, because the normal range, as many of you know, is not the healthy range. And you can be in the normal range and be very unhealthy. We're going to talk about that a little bit later with a specific example that I think is shocking. And patients are starting to understand that their annual physical with their primary care physician, those blood panels they're not worthless, but they're certainly not teasing out the important pieces of information that can motivate the patient towards better health and wellness. So without further ado, this is a test referenced in the bottom left, not a test, a study that I found a couple years ago that really shocked me. And it was using NHANES data, and they looked at the Triglyceride-Glucose Index for a group of about 2,000 people. I think their average age was around 58. And what they did was they stratified Triglyceride-Glucose Index, which is a great marker for insulin resistance, and they correlated that with the risk of developing Alzheimer's disease over a 10-year period. And what they found, I think, is shocking. Basically, if you had a TYG below 8.28 or 8.2, your relative risk for developing Alzheimer's over a 10-year period was 69% less than those folks who had a TYG of 8.8 or greater. So the important thing here is the context. What does an 8.8 mean? Well, an 8.8 TYG equates to a fasting glucose of 97, which is quote unquote normal. It's certainly not optimal, but it's normal. And a triglyceride level of 140. Once again, certainly not optimal, but really not abnormal in our population. So if you had a 140 and a 97, your triglyceride glucose index would be 8.8, and your relative risk for developing Alzheimer's would be almost 70% greater over 10 years than a patient who had 85 and 85, fasting glucose of 85 and a triglycerides of 85. It actually kind of goes up towards 90 on both of those numbers. But the important thing here is, if you're trying, you can get your triglycerides down to 90, and you can get your blood glucose down to 85 or 90. It's not beyond the realm of reality. The important thing is, patients, I believe, would be highly motivated to make that effort if they knew they could cut their Alzheimer's risk by 69%. So that's the kind of stuff that we really try and tease out in this test and this report. I think it's extremely valuable. Rather than just saying you're in the normal range, see you next year, we can say, look, here's some powerful information that may motivate you to clean up your diet and get off the couch and build lean muscle and cut back on sugar and starch and carbohydrate to the degree that you can. So takeaway message is, both these patients had normal blood test results, but their risk was vastly different from one another. So it's a little complicated, but this is how it all fits together. If you look at this diagram, you'll see that inflammation and oxidative stress are in the middle. Obesity and visceral fat are really what start the ball rolling, and the involvement of fatty liver, diabetes, and heart disease all tie into insulin resistance. So yeah, there's a lot of information here, but it's how it all fits together. And then if you look at each of the large yellow dots, you'll see a marker number, and that's the marker on the cardiometabolic test. That's the number of the marker when we get into the individual values. I really tried to distill this whole thing down to what was most important. And this is on page, I think, 4. And basically there are 4 keys, in my opinion, to cardiometabolic disease. It starts with visceral fat. It leads to insulin resistance, which creates fatty liver. And all of that manifests in terms of residual heart disease risk, which we should be looking at, not just LDL and total cholesterol. But the way visceral fat drives insulin resistance and fatty liver is really the foundation of cardiovascular and metabolic disease. And so if we're talking about cardiovascular disease and lipids, but we're not telling our patients where it starts, I think we're doing them a disservice. So this is the results page, page 2. We designed it so that patients could take this to their traditional MD, and the MD would know what they're looking at. So the top half of this is basically standard markers. The bottom half are the cardiometabolic markers and indexes Um, we do use gender specific ranges, and we have both standard reference range and optimal reference ranges for patients. This is an example of one of the 10 primary markers, and this is how we lay out each of them. This one happens to be the liver health indicator, which is fatty liver index. We show them their value. We tell them where they want to be and why. We tell them, we show the patient how to improve the conditions that we're trying to avoid, what they can avoid to help their health in this regard, what supplements may be appropriate, and what other tests to consider. So for each of the 10 markers, they'll get this. And these are the 10. And once again, this is tied back, all these 10 are tied back to a single number, which is on page 1 of the report. After we go through each individual marker, we kind of go through some what ifs just to put it in context for people. So these examples let people kind of tease into what details are associated with each marker, each of the primary markers, and how they could play out and how they could make changes that would help. The biocalculators is the next page after that, and this is for those folks that are motivated to calculate where they are, where they want to be, and how to get there. A lot of patients want to rely on us, on the practitioners, to do this for them, but there are patients that would love to be able to do this on their own, and so we give them the tools to do so. We also say, hey, we've opened the box here and shown you how things work. If you want to go dig in further, here are the primary markers that are playing or at play in cardiometabolic physiology, and here's how you can do further research if you're so inclined. So in conclusion, first of all, thank you for your patience. We've got a really good tool here. It's well priced. It applies to the bulk of your practice. It is easy to use for your patients and for you. It's a force multiplier in terms of you can do group screenings, group testing with this, and really increase your efficiency. The report is, I think once you see the report, you'll wonder why more reports aren't designed this way. It's affordable. Right now it's on sale for $129. I think we'll probably, the retail or the practitioner price is $159, but we'll probably settle a little bit lower than that going forward. The retail price is $239, so there's room for you to mark up and to put it into a package with a consult. And still, my goal when I'm trying to do promotion, trying to bring in new patients, I think a $295 price is a good one. And you can have this test and a consult for $295 and deliver a ton of value to your patients. Yeah, I've gone through all of this. So thank you very much for your patience if you're still here. This is the Cardiometabolic Test and Report. It is one of a growing family of cost-effective, comprehensive, smart tests that we're bringing to functional medicine and integrative health practitioners to help them be more effective, grow their practice, and help more people. Thank you very much. This is Steve Bennett signing off.
For any questions or issues you may have, contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Bennett, for this informative presentation. Thank you all again for joining us on this webinar event. Until next time, from everyone at Avexia Diagnostics and Cardiometabolic, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.